Not only does full core taste great, but it naturally quenches your thirst and appetite while rehydrating your body. I'm Dr. Barry Ross, and I trained at Mount Sinai Hospital in New York City. I did my residency and my medical training there, went and did my fellowship at Jacksonville Hospital in Miami, and now I've been in private practice as a board-certified gastroenterologist for the last 15 years. The health crisis facing America today is the crisis of obesity. Obesity has led to many other medical conditions, including high blood pressure, diabetes, heart disease, and stroke. Full core helps in solving the obesity problem as it promotes digestive health. Digestive health today is an issue as physicians, we are looking at to help our patients with many, many different problems. Specifically, we are very interested in the use of fiber and how that helps us in our digestive health. There are many problems that I see in my office that can be attributed to obesity. Obesity has led to problems like high cholesterol, high triglycerides, heart disease, and even stroke. In my population of patients, I see other GI ailments known as diverticulosis, which are the pockets in the colon, constipation, with issues with bowels, hemorrhoids. These are all issues that I see in my patient population, which all can be helped by the use of full core. Full core does not only contain an invisible fiber, but it also has 15 vitamins and minerals in it. Fiber in general, which has been known for years, can help aid in weight loss. The way we help our patients is we have our patients, or the patient population, take pre- and probiotics. I often get asked, what is a prebiotic and what is a probiotic? A probiotic is a supplement that is found sometimes in yogurts. Basically it's a bacteria. And that bacteria is good bacteria that's needed for our own digestive health. In fiber, fiber is actually a prebiotic, or in full core, having that 10 grams of soluble fiber, a prebiotic enhances our own good bacteria. It helps our bacteria in our system, and if we add in a probiotic or good bacteria, it actually enhances the probiotics in our system as well. So people often say to me, do I have to take probiotics every day? Well, I tell them if they're on a fiber supplement of any type, or on a digestive health drink of any type, they actually do not need as much probiotics, or as many, because the fiber that they're putting into their system actually stimulates the small amount of probiotics that they can add into their diet. Full core has been used as, it helps quench your appetite. So a lot of my patients are interested in weight loss and in digestive health. So for those patients who are interested in weight loss, I have them take a full core, a 10-gram fiber supplement, about 30 minutes before their largest meal of the day. And what happens is their appetite gets suppressed, and I have a plan that says cut out a third of your dinner, if that's your largest meal or your lunch. And if you take a third out, which could be anywhere from 300 to 500 calories of your meal, not only will you feel full because the effects of fiber are feeling satiety or fullness, but you also will decrease your caloric intake for the day. If you continue on that path of 300 to 500 calories a day, anywhere between 10 and 12 days, you probably will lose a pound. And most patients I like to lose 3 pounds a month at a maximum. 3 to 4 pounds is more than adequate. And that slower weight loss, they tend to keep it off. So one can a day is adequate, but oftentimes I'll have patients go on and take a second can. In fact, I have a lot of patients who like to eat out, and then people say, what do I do when I'm eating out? Again, they can take a full core before their largest meal, which will be before going out, or let's say they now want to take more than one a day. I have them do one before lunch or even in the morning, and then a second can before their dinner or before they go out for dinner. And in this regard, they can actually cut out an appetizer, which could be a 500 or 600 or 700 calorie appetizer, which not only saves them money, but also promotes them they think about eating less for that meal. I often get asked, well, how much is 10 grams of fiber? Well, 10 grams of fiber in dietary measures often will equal, a small apple could be 1 gram, so 2 apples will give you 2 grams of fiber, plus a cup of peas could be another 3 grams, and a cup of pinto beans could be another 3 grams. So you might reach, to the 10 grams with all of that supplemental fruits and vegetables, and yet people don't want to take that much in the way of fruits and vegetables. Although how healthy it is, they should probably do both. I often get asked, what is soluble fiber versus insoluble fiber? Soluble fiber is a fiber that actually is dissolved in water. So it's a clear, colorless, it can be made in a clear, colorless solution, just as we have in full core. Insoluble fibers are not dissolved in water, so they would be like the skins on your potatoes, the skins on fruits, the stuff that is very healthy for us, but again, acts a little bit differently in our body. The insoluble fibers will bulk up the stool, will bulk and make a lot of patients feel better in that regard, but soluble fiber have many more benefits to it. And when you have a soluble fiber, that's when you actually coat the intestines that we were mentioning earlier, and when you coat those intestines with the fiber, you get better, you get a decreased absorption of carbohydrate, you can lower cholesterol levels, you can lower triglyceride levels. It even promotes, in digestive health, it promotes our immune systems. Our immune systems are affected by our digestive health. Calcium absorption gets affected, so bone health is also affected by the right amount of fiber as you increase your fiber. I've had patients come to me and say, wow, their arthritis feels better. Again, these things haven't been formally studied, but I'm seeing this more and more in my patient population. I often get asked in the office about weight reduction, and a lot of times I will use fiber as an aid in weight loss. Well, how does it work? Well, fiber in general does quench our appetite, and it makes one feel full. And the more fiber that you can take in at one particular time, yes, you will feel fuller for an extended period of time. The fiber in full core, which is all soluble fiber and only contains 25 calories, you're getting that full feeling with a 25-calorie drink, and you'll be able to eat less over a longer period of time. So weight reduction will naturally occur. Another way that fiber helps us is by decreasing something known as visceral fat. There's two types of fat in our body. There's visceral fat and subcutaneous fat. Subcutaneous fat is the fat basically just below the skin level. And the visceral fat is that abdominal fat that's basically around our organs. And that fat is very detrimental to our health. So there was actually a study back in June of 2011 that showed with an additional 10 grams of fiber intake, that one can decrease their visceral fat content by almost 4%. With moderate exercise, you can actually decrease that visceral fat content by almost 8%. And this is over a 5-year period. So this study was done by actually using CAT scans to actually measure the visceral fat. And we think now that by increasing by at least 10 grams, we are really promoting digestive health and health in general. Can everyone use full core? The answer to that is yes. There is not one patient population that I've seen thus far that shouldn't use full core, except for those who are probably under the age of 4 years old. Why that is? Because they just don't take in enough calories during the day to warrant an additional 10 grams of extra fiber. We usually talk about 13 to 15 grams of fiber per 1,000 calories of intake. And a lot of our younger population at this point don't even take in 1,000 calories, so I would hold off on fiber in those under 3 or 4 years old, but any time after that is fine. As a physician, we do see many different medical conditions. One of these conditions is called the metabolic syndrome, which is actually a risk factor that increases diabetes, heart disease, and stroke. And the risk factors that lead to this increase in those diseases include what we call central obesity. Central obesity is basically belly fat, fat around your mid-gut. And one of the reasons why I recommend fiber, especially soluble fiber, to my patients is that decreasing weight and decreasing central obesity can, in fact, decrease your risk of this syndrome X or metabolic syndrome. Not only do I drink full core, but I'll be wholeheartedly recommending it to my patients. It has 10 grams of soluble fiber, 15 vitamins and minerals, and a natural sweetener. And the good news is there is no caffeine, there's no sodium, there's no gluten, and there's no cholesterol in this product.